Hi, I'm Dr. Downey. Today we're going to talk about carpal tunnel syndrome. Who gets it, why you get it, what you can do about it. But before we do this, I need to show you some structures, anatomy structures, so that you'll understand what we're talking about better. This here is your carpal tunnel area. This is the palmar surface of your hand. We'll turn this around. This is the dorsal surface of the carpal tunnel. There's 8 bones here. They fit together like jigsaw puzzle pieces. They're held together by ligaments. We'll talk about this later. What I want you to see here, which is very important, is where I'm going to put my finger here. This is on top of the carpal tunnel area. There's a ligament that goes between this bone, these carpal bones, and underneath my finger is the true carpal tunnel area that we'll be talking about. So now that you're oriented to the structures that we'll be discussing, let's talk about it. Carpal tunnel syndrome is an overuse syndrome. People get it usually through repetition. And the problem with it is, and the reason people that develop it, is through this tunnel that I showed you, has to pass 9 tendons that go into your finger, making your fingers move. Also, in addition to those tendons, is your median artery, your median nerve, and your median vein. Now understand this. The tendons in your hand are like spark plug cables. They're very hard. They're non-compressible. However, the other structures, the median artery, the median nerve, and the median vein, are like elastic tubing, and that they are able to be compressed. So that through repetition of these tendons rubbing upon one another, the layer that surrounds each one of these tendons can begin to thicken and get inflamed. You multiply that by 9 tendons in this carpal tunnel area, and you begin to fill up the tunnel. That is what carpal tunnel syndrome truly is. It's simply an overcrowding issue. As those tendons begin to expand and take over, they start to compress the structures in the tunnel. Now, what are the only 3 compressible structures in the tunnel? The median artery, the median nerve, and the median vein. That'll be a good Trivial Pursuit answer for you. Anyway, as they start to take over, then those compressible structures in the tunnel begin to compress. And the first thing a person begins to notice if they have true carpal tunnel syndrome is a numbness or tingling into these 3 fingers. Why? It's because there's only one nerve that passes through the carpal tunnel area, and there's 3 distinct nerve supplies into your hand, by the way, and it goes into these 3 fingers on either side. It also goes to this, what we call your thenar eminence, which is the muscle that opposes your thumb. In fact, I'm going to show you a couple tests we do for carpal tunnel syndrome, and knowing what carpal tunnel syndrome is, you'll understand why people get it. You can take a person, you can have them put their thumb and their little finger together, and you try to pull this apart and see how strong they are. You compare the good hand to the bad hand. You'll find, because the muscles of the thenar eminence get their nerve supply from the median nerve, that it'll be weaker on the side that you have carpal tunnel. So that's one test that could be positive. A better test is if you take your hands, remember the carpal tunnel is found at the crease of your wrist. If you take your hands, push them together to 90 degrees on each side using gentle pressure, and hold your hands up above the level of your heart for 30 seconds, you see if it begins to reproduce the symptoms that you had, which would be numbness or tingling into these 3 fingertips. A lot of patients will come in and say, well, Dr. Downey, I've got carpal tunnel syndrome. And I say, well, okay, where do you feel it? And they'll say, well, I feel it into these fingers. It's not carpal tunnel syndrome. There's 3 distinct nerve supplies in the hand, and only one of them passes through the carpal tunnel area, and it goes to these 3 fingers. So let's talk about what they do from a medical standpoint. From a medical standpoint, it's not rocket science. Literally what they do is they go in there and clip the ligament in the carpal tunnel area, doing this, opening it up. Good news is it relieves the symptoms in the short term. Bad news is it weakens the hand up to 60%, some studies have shown. The other thing that happens is after you put any incision in the body, whether it be a surgical procedure or whatever, it can begin to fill in with scar tissue. Scar tissue is less pliant. It's a harder tissue. It can actually invade the carpal tunnel area, causing more of a problem than you had before you had the surgery. Make sense? So do you suppose you might be interested in something that could help without surgery, and a lot less cheaper, I might add, a lot cheaper, I might add. Okay, these carpal tunnel bones I showed you, they fit together like jigsaw puzzle pieces. If you could get somebody, the carpal tunnel area, the side walls, the floor, are all formed by carpal bones with this ligament sitting on top. If somebody could come along there and stretch those ligaments out, why, you'd make more room in the tunnel. That's why we've worked on hundreds of cases of carpal tunnel syndrome, helping them, and very few of them have to have surgery. So, thought you might be interested in it. The other thing I want to mention to you, and that is people that develop carpal tunnel syndrome, you need to be aware of what they call the double crush syndrome. And that simply means this: the median nerve that passes through the carpal tunnel originates in your neck. It has to pass through the shoulder, elbow, and then into the wrist. If you're seeing any physician for a carpal tunnel syndrome-like problem, you need to make sure that they're checking the neck, the shoulder, and the elbow, because compression of the nerve at any one of these levels magnifies the symptom of carpal tunnel. We've treated patients that have actually had carpal tunnel releases, and they still have persistent symptoms, and it's because it's come from a neck problem or a shoulder problem or an elbow problem. So any chiropractor, or a physician for that matter, worth their salt, are going to check all of those areas. I think that's about it. Hope you learned something. Talk again soon.